Today in The Good Life, a renowned Filipino plastic surgeon with an eye for beauty and a heart for charity. A treatment that will bring back the smoothness and suppleness of your skin. Tips on how to stand out in any garb through accessories. Introduced to you a restaurant that offers contemporary Spanish cuisine. Life-saving knowledge on how to prevent death from a heart attack. And show you a fine dining restaurant that is perfect for a romantic dinner. A little bit of this and a little bit of that this Sunday. A little bit for the heart and a little bit for the soul. I'm Cory Quirino and this is The Good Life. Stay with us. I love it. Years of dedicated study and dutiful practice have brought Dr. Sanchez to where he is today, a highly esteemed and much sought-after plastic surgeon. Dr. Sanchez heads MD Eastwood, a mall-based medical facility in Libis, Quezon City. We saw him at his clinic as he performed rhinoplasty or nose lift surgery on a male client.
Christian, I will simulate the position of the implant when it's inside, okay? Inside your nose. So that when I take a look on a side view, okay, there is moderate increase in the height of the bridge of the nose. This is the approximate amount of increase in the height of the bridge of the nose. And there is a good anterior projection of the tip. Instead of going down like that, we want the tip to be a little bit projected anteriorly or forwards. Okay? Christian, we're going to start. Okay? You'll be comfortable.
Dr. Sanchez was pleased to know that many of the menfolk are paying more attention to their looks and are unafraid to undergo surgery in a bid to look good and feel better about themselves. He has performed thousands of rhinoplasty in the course of his career and is best known for his natural-looking results. Filipino men who wish to undergo nose lift can benefit from Dr. Sanchez's specialization in creating just the right oriental nose for that oriental face that perfectly complements Asian and facial features.
All right. There you go. As I see it, your nose is in harmony with your face. Okay, so if I put the stick, put a on the lateral side of your nose, drop a line, vertical line, from the angle of your eye. The nostril is still within limits, normal limits. Because of the increase in height, you were able to reduce the alar flaring. Okay, you have a slight alar flaring, but this fits your face. Okay, it is in harmony with your face. So we're not going to do alar trimming as planned before. Tom Cruise. Okay. All right. Did you feel anything at all? Okay.
In spite of his success and stature in the industry, Dr. Sanchez is not one to turn a blind eye on the less fortunate who desperately need his services. Initially reluctant to publicize his deeds, we were able to prod him into doing so after explaining how this could in turn inspire others to do the same. For several years now, he has quietly been performing pro bono reconstructive surgery on patients with cleft lip and palate, commonly referred to as hair lip, a condition that occurs in roughly 1 out of 700 births and more prevalent among Asians and North Americans.
The cause is multifactorial, and malnutrition is the main factor that they blame that causes these cleft lip deformities. Heredity plays a minor role. Studies have been made in the past, and they found out that malnutrition plays a major role, and particularly deficiency in folic acid and other vitamins, and other conditions like infection during the first trimester of pregnancy, and intake of drugs are also blamed to cause this defect. Well, for the cleft lip condition, the main problem here is the facial deformity. The child will have inferiority complex if the defect is not repaired.
Speech development and normal feeding is hampered in patients with this condition. Even more serious is the blow that this abnormality deals on a child's self-esteem.
The other problems that the patient can have is these patients are prone to infection like middle ear infection aside from respiratory tract infection.
Fortunately, the cleft lip and palate can be surgically connected, but not without the attendant cost.
The parent of this patient approached me. Apparently they had a neighbor who had a cleft lip palate, whom I had done before, and they were impressed with the result. When I first met this kid, I think he was a young boy, he's less than a year old.
I'm Gomer Basilio from Quezon City, and my wife, Net, and my son, Bon.
I am 11 years old.
Siyempre, first baby mo, excited ka makita. Hindi kasi medyo nahirapan din kasi siya mga anak. Almost 26 hours siya labor. Nag-decide yung hobby niya na CS lang.